The CEO just wrapped up his press conference less than a half an hour ago. He started by apologizing to the patient and saying this incident doesn't define who they are. The patient was not discharged because she did not have insurance or money to pay, he said, and they take full responsibility for their failures.
We believe firmly that we provided appropriate medical care to a patient who came to us in need. But where we absolutely failed, and where we own that failure, is in the demonstration of basic humanity and compassion as a patient was being discharged from our organization after having received that care.
They say individuals will be held accountable but could not provide any more details. We spoke to one woman, though, who has a glimpse of what it was like inside the ER that night.
Come and sit down.
The video has gone viral. A woman escorted out of the University of Maryland Midtown campus and left at a bus stop with nothing but a hospital gown and socks.
I was disgusted. And when I seen the video, I'm looking like, well, dang, that's the lady I seen in the hospital.
Tania Wise says she was in the emergency room at the same time as the woman and saw one interaction between the woman and a nurse that she calls disturbing.
She was sitting like on the ground, like in the hospital floor, and they was telling her to get up. It was not what she was saying, it was how she was saying, like really very nasty. Like talking to her, you know how like when you fussing at your child, like get up, get off the floor like that, you ain't no child.
Wise says she could tell the woman was disoriented, didn't understand what they were saying, and was not able to verbally communicate with them. She didn't see the woman after that exchange until she saw the video. 11 News spoke to the woman's mother, who says her daughter is 22 years old and has a history of mental illness. A family friend says she's schizophrenic and on the autism spectrum.
It is absolutely unacceptable.
Patrick Moran is the president of the American Federation of State, County, and Municipal Employees. That organization has been outspoken on the need in the state for more available beds for mental health patients. Moran says this video is a sad example of that.
She should have been at one of the state's mental health facilities in a bed, being medicated with a treatment plan to get her stabilized and moving forward.
The hospital released a statement saying in part, quote, "This unfortunate event is not representative of our patient-centered mission. While there are many circumstances of this patient's case that we cannot address publicly, in the end, we clearly failed to fulfill our mission with this patient. We are taking this matter very seriously, conducting a thorough review, and are evaluating the appropriate response, including the possibility of personnel action," end quote. For Tania Wise, the solution is simple.
I feel like she deserved an apology. She deserved to, get some type of help. They should help her.
Now, this is the bus shelter right here where she was left at night along Howard Street and the light rail tracks. Now, as far as the patient goes, her mother says she has been taken to another hospital where she is receiving treatment. Reporting live in Midtown, Kim Day, CWBAL TV 11 News.